allows us to make sure we're always in the same depth. This gives you an idea of the pattern. I don't know if you see that from there. Where do you want to pan into that?
It's right there.
Right. So you can see those little dots are the areas that actually penetrate to whatever depth we set the machine at. And between them, there's little skip areas. That allows the skin to heal not only from below, but it allows us to let the skin heal from side to side. So there's a faster healing rate. With the previous CO2 laser, which was more of an ablative laser, basically treated the whole surface of the skin, and you didn't have skip areas. So the healing time was much more prolonged. It would take weeks for the patients to get their skin back to a normal color, whereas with this, they're healed within 3 to 5 days, and the pinkness is gone within 2 weeks. So that's one of the advantages of having the fractional CO2. Besides, it also allows us to penetrate deeper, so we can achieve a better result. Now, you might be able to see how the patterns are not that versus this one, the skip areas are much smaller, and we're over-treating areas. That's why it's darker, because you're actually hitting areas probably almost 100%.
Gotcha. I see what you're talking about with the skip area. It actually makes little lines.
Right.
Almost.
These are actually little computer-generated dots.
Right. Okay.
This gives you an idea of the. This gives you an idea of what you were actually seeing.
Gotcha.
At a close-up, and then this, as I was telling you before, allows us to penetrate to whatever depths we want. This top layer here is the epidermis of your skin. This is the dermis, and then this is the fatty layer. Your hair follicles and blood vessels all generate down here, sweat glands and so on. We don't want to penetrate that deep because we can promote scarring. What we want to do is set the deep FX settings so that we penetrate to about this layer here. So this allows us to get beneath most of the scar areas and beneath most of the deep wrinkles. We follow the deep FX with the active FX. The active FX, this is a blow-up of this portion of the skin. So this is the epidermis again. This is the upper layer of the dermis. With the active FX, we're only going into the epidermal layer, so we're basically treating pigmentation problems, as well as making the pores smaller and treating some of the finer facial lines.
Gotcha. Now, Sarah, you're going to be treating Sarah here in a little bit.
Mm-hmm.
Now, she's got pretty big or significant acne scars, but what's your opinion on that?
Well, she fortunately doesn't have what we call ice pick acne scars.
Okay.
Ice pick acne scars are the very deep ones, and those we wouldn't want to treat with a single setting or a single treatment. With Sarah's situation, basically her acne scars are in this area of the dermis. So, as I told her before, we tend to be a little conservative because we don't want to go so deep that we can promote scarring or pigmentation problems. However, we will go deep enough to treat most of her acne scars with a single treatment. But, as I explained to her, she may have to come back for a second treatment on some of the deeper ones that haven't totally resolved.
Gotcha. Now, how long have you been doing this kind of process?
Well, the fractional CO2 laser, I've been doing it for about a year and a half. The laser came out a little over 2 years. Oh, sorry. The laser came out a little over 2 years ago, and there are a few of the other companies have made fractional CO2 lasers, but they're certainly not as powerful as this one. And the importance of having a powerful laser is it doesn't have to be on the skin as long. The power allows it to penetrate deeper, and the importance of that is that you don't want collateral damage from the heat generated by the laser. So if you have a shorter pulse, then there's less heat generated to the surrounding tissue to cause further damage.
Gotcha. All right, so walk us through as far as, because I see some equipment out here, we have some ice and some syringes and stuff, so walk us through what Sarah's been experiencing.
Okay, now, presently Sarah she was given some pain medication, something to relax her. Prior to coming to the office, we gave her some pills to take. Once she got here, we also gave her some more, so we're kind of dosing those.
Okay.
And she will also get an application of a topical anesthetic cream. The anesthetic cream contains actually 3 different types of anesthetic. It takes about 45 minutes to take effect, and it will last for about an hour, but it gives a good topical anesthesia to the face. Now, in addition, I'll also use a local injection of anesthesia using 2% plain xylocaine, and we'll inject this what we call field blocks. There's nerves that come out from the medial portion of the eyebrow that numb the forehead. There's nerves that will come out just below the cheekbone and eyelid junction that innervate the cheek and the upper lip. So we'll treat those with injections here. We'll also inject into the mental nerves, which come out through little openings in the bone and provide sensation to the lower lip and chin area. I'll also put a few injections along the jawline here. We're not going to treat Sarah's neck because she doesn't have any problems there, but we're going to feather the treatment. In other words, the area between the treated and untreated, we're going to treat that a little lighter to kind of cause a slight phasing of the laser so that the line of demarcation between the treated and untreated areas is smoother and not as visible. And we try to put that underneath the jawline so the girls can just cover that with makeup.
Gotcha.
And within a couple weeks, that line smooths itself out.
Gotcha. Now, once you start with the lasering, from start to finish,
yeah.
how long?
Probably about 5 to 10 minutes for the deep FX and about the same amount or maybe even a little less for the active. So the actual treatment time is going to be 15 to 20 minutes.
Wow.
Pretty quick. But
yeah. And it takes approximately, 5 to 10 days for it to heal?
She'll actually it chars that top layer of skin, so it's like you got a very, very bad sunburn. And within about 3 days, all that charring is cleared off. We give her a Cetaphil soap to use, and she applies an antibiotic or a healing ointment that's got a vitamin E and vitamin C in it, and copper peptides and so on, and that promotes the healing faster. So she'll apply that for about 5 days. Within 5 days, she can apply makeup.
Gotcha.
And she'll have a little pinkness to her skin tone, more than her normal pink, and that will last probably 1 to 2 weeks.
Gotcha.
But she can cover that up with makeup.
Gotcha. Now, what's the ice for?
The ice is for after we finish using the machine's pretty hot.
Okay.
We actually also use a cooling wand that cools the temperature of the skin down. We set it below 32 degrees. And that's actually cooling the skin while we're treating her with the laser. But after we've treated her, we'll take some 4x4 gauzes and put them in ice and then apply them to her face, and that helps cool it down. And most patients, after they go home, will take some Advil, but that's about all they really need. It's not a very painful procedure.
Great. Okay.
Okay.
I'm going to do some close-ups of all that, so that way I can stay it on his face, so that way you can always have somebody cut away to that if you need it.
Why don't we do
Yeah,
that's great, yeah.
She's not our designated driver. Yeah. Now, have you taken any?
No, as a matter of fact.
Now, it's probably better to do it once we take the cream off of that, so that you get a better picture. Yeah, cream kind of obscures it.
So right now she's using the cream on there to number out.
There's going to be a lot of noise while we're doing the procedure. Sure, I will. She's got the